So you can know how many attendees are on now?
Yes.
Next one.
Okay.
I think let's start now in order to start in time somehow. And I think we have a quite good number of attendees for the time being. The session, by the way, is live also on Facebook on the eye dermatology group. Okay, perfect. So good evening, everyone. Thank you so much for your honorable attendance again to the eye dermatology webinar series done by NAUS. Actually, the eye dermatology as a program is an innovation from NAUS in order to exchange all the dermatological updates from everywhere across the world, whether in face-to-face or virtual form. And this is probably our 6th or 7th webinar. And hopefully the eye dermatology as an idea, the exchange we do from different countries across the world with different key opinion leaders will really satisfy your scientific eagerness. Today, we have actually two eminent speakers, and we would like to thank them first for accepting to be with us today on this virtual eye dermatology webinar, talking about the recent treatments of acne and acne scar, featuring two special, very special, is Dubai residents, Dr. Balkis Marwan, specialist dermatologist and laser therapist in Dermaghamia Skin Clinic, Dubai. And the other one is a very special doctor, Dr. Hassan Al-Fakharani, associate professor in dermatology, sexual transmitted diseases and andrology department in Minya University in Egypt, dermatologist and laser therapist in Al-Fakharani clinics in Minya and Rejavu clinic in Cairo. Before I give the floor to our honorable speakers, let us have a short, allow us please to have a short overview of what NAUS stands for, what is our philosophy when we are formulating our brands. And here I will leave the microphone to my colleague Vinetta, who is the medical marketing manager of the GCC. Please, Vinetta, the floor is yours. Thank you so much.
Thank you, Marwa, for the introduction to tonight's series of eye dermatology webinars, which is really like a unique dermatological digital space and forum, giving a chance for exchange on the latest practice and best experiences and dermatological practices across GCC, across the MENA region and across the world. Before we continue, just a few words on what is NAUS. As we say, it's eye dermatology by NAUS. What is our philosophy and what stands behind our motto of care first? Our philosophy is actually inspired by life. Why? Because life is about action, interaction, and footprint. And 40 years ago, our founder, the French biologist and pharmacist, Jean-Noël Tourelle, he took a different look at skin and different approach than what was just the superficial in the industry embellishment of skin. So his idea is that instead of over-treating the skin, we should give it just what is necessary, neither more, neither less, to bring it back to its natural biology and to help it adapt to its ever-changing environment. So this approach for more than 40 years has been our philosophy, and it goes with ambition beyond just the skincare, but to human care, health, beauty, and well-being. Today, ecobiology, which is the synthesis of ecology, the science of interactions, and biology, the science of life, is the cohesive system of the three iconic brands that NAUS is holding. And this is Bioderma, which is dermatology in service of biology in the service of dermatology, and Estederm, which is biology in the service of aesthetics, and Etapure, which is dermatology in the service of personalized skincare. More about ecobiology, we will be continuing to share as philosophy and how it is in practical terms implied in our formulation principles. Now I would like to continue with iDermatology by NAUS, the webinar tonight that we'd like to share the knowledge on recent treatments of acne and acne scars. And Marwa, I give you the floor again to present our honorable guest speakers tonight.
Okay, so it's time today to start with Dr. Balkis Marwan. Again, our topic, I just want to remind everyone that our topic today will be talking about recent treatments of acne and acne scars. And before Dr. Balkis starts, I want just to give a very small resume about Dr. Balkis. She's currently specialist dermatologist and laser therapist in Derma Premier Skincare. She obtained her master's degree in dermatology from Al-Minya University in Egypt. So actually, I think you and Dr. Hassan were already classmates. Continued working as an assistant lecturer from 2000 till the end of 2012, and discussed her MD research on 2008. Dr. Balkis holding a diploma in aesthetic medicine from the American Academy of Aesthetic Medicine in 2010. She is practicing clinical and aesthetic dermatology in UAE since 2009. And she has her private work in 2015, established her own Derma Premier Skin Clinic. Thank you so much, Dr. Balkis, for being among us today. And please, the floor is yours.
Thank you, Dr. Marwa. Thank you, Benita and Dr. Hassan. I think I prefer to start with the acne, and then as a continuation to go in order, I will go for acne scars, because the topic with Dr. Hassan talking about the more advanced treatment in the active lesions. So going in order, I'll talk about the acne scar after that. Please,
Okay.
Dr. Hassan, start.
So hello, everybody. I'm very honored to be with you tonight. I'm Dr. Hassan El-Fakahani. I'm an associate professor in Kenya University.
So if you allow me, Dr. Hassan, I have your full CV. If you allow me to give a couple of introductions about you. So also we have our honor to have Dr. Hassan, again, another very dear professor from Al-Minya, Egypt. He is an associate professor in dermatology, sexual transmitted diseases, andrology department in Al-Minya University. Dr. Hassan is practicing dermatology in Al-Fakharani Clinic in Minya and Rejavu Clinic in Cairo. Dr. Hassan has his master's degree in dermatology and sexual transmitted disease in Minya University in 2003. And he's also a got his postgraduate fellowship from Yale School of Medicine in the USA in 2006, followed by the MD in 2008. Dr. Hassan actually is a speaker in many international conferences, and I remember very well that the first time I met him was in Milano, I think last year or 2 years ago, and trained doctors with hands-on workshop. He's also an author of articles, medical trainings, book chapters, and innovations in the treatment of skin and reproductive diseases. Again, thank you so much for having you today and getting a lot of your precious time. So please go ahead.
Thank you very much. Today, I'll be talking about acne and what are we going to do with active acne. So I hope my talk will help you in treating all the patients that we have. Let me start with. Okay, so now I'll be presenting the talk about acne. I'm Dr. Hassan El-Fakahani. I'm not going to talk about the pathology of acne. All of us know the pathology of acne, and we'll start saying, is it only one disease? It has different presentations, from very mild lesions to very severe cystic acne lesions involving multiple areas in the body. So our aim of treatment of acne is to achieve an initial control of acne, maintain therapy to prevent flares of acne lesions. We need to manage the psychological morbidity and prevent scarring. Our stages of treatment should be in 3 stages. First, treatment of active lesions, then prophylactic therapy to prevent recurrences and flares, and then the treatment of the post-acne scars and sequelae. So when we are treating patients, we are not only prescribing drugs or making sessions. It is simply a lifestyle modification for patients of acne. You have to tell them everything about their life and how to take care of their skin, about their psychological aspect, about dealing with the acne lesions on their faces, sweating, sun exposure. So you are totally talking about their lifestyle, not only about their treatment, whether it is drugs or sessions. We have very common therapies for acne. We have topical therapies in various forms, and we have systemic therapies. It's not only the therapies that we need, it's also the lifestyle modification, as I told you before. And we have non-medical treatments of active acne lesions. This is the one I'm interested in talking to you about, especially my personal experience in the last few years. We had comedonal extraction, cryotherapy, intralesional steroid, superficial peeling, and microneedling. But this in active acne carries the hazards of making scars. So now we use the red and blue light as a kind of phototherapy for active acne and the Nd:YAG laser. But do we need these expensive machines of Nd:YAG lasers in active acne? Does it make a difference? This is what I'm talking about in the next few slides. This is what I'm telling you about. If you did a microneedling on one of these maneuvers to active acne lesions, you might end with scarring as this patient who had scarring after 3 sessions. This is a kind of machine that is used at home and also we use in our clinic. This is very simple and very cheap sessions. It constitutes of red and blue light, which helps in killing the Propionibacterium acne and decrease the load on the skin and also prevent scarring. Instead, we now use Nd:YAG lasers with FRAX3 parameters. It is very nice, excellent results in active lesions. It's safe with no pain because we use very special parameters that carries no pain for the can replace or reduce minimize the duration of treatment. So the FRAX3 parameters is very short pulse duration of Nd:YAG laser. It is from 0.3 to 1.6 milliseconds for the laser shot. And it is very low energy. It might range from 15 to 35 joules per centimeter square. We do sessions every week or every 2 weeks according to the case. Here are some cases that I did before with no topical or systemic therapy. These are cases with mild inflammatory papular or pustular acne. weekly sessions for 4 successive weeks, and we can see the improvement with no topical, no systemic treatment. This is another case, no topical, no systemic treatment, just Nd:YAG laser with FRAX3 parameters for 2 sessions. Sometimes we need more topical therapy to mild to moderate the cases of inflammatory papular or pustular acne. These are cases which I did 138 patients. They usually use topical retinoids at night, and we have daily washes and cleansers and emollients at night. We have session every 2 weeks for 8 successive weeks. This is a case which we used only topical retinoids with FRAC3 Nd:YAG lasers. You can see the improvement with only topical retinoids, no antibiotics, no other systemic treatments. Sometimes when there is hyperpigmentation, we use the azelaic acid. We need some sunscreens to avoid the sun exposure. We use some cleansers, and then we use the azelaic acid twice daily. This is another case that I did with FRAX3 parameters and azelaic acid, just topical azelaic acid, no systemic treatment is added to the treatment. You can see some improvement in only 4 sessions with topical azelaic acid. Sometimes we use systemic azithromycin in moderate to severe cases of inflammatory acne, but there is a common problem, which is diarrhea. The patient suffers from diarrhea. The dose is 500 milligrams per day in a single daily dose for 3 successive days of every week till 4 weeks. And this is another case that we used the Nd:YAG laser with FRAX3 parameters in inflammatory acne. You can see improvement in the inflammatory lesions with just azithromycin. Sometimes we use the doxycycline in patients not responding to azithromycin or having a lot of diarrhea, but also the doxycycline has a problem of the gastric upset. This is another case that we did before. This is the cases after beginning and after 2 sessions and after 4 sessions. Even with systemic retinoids, I can use the FRAX3 parameters with no any fears of scarring. Only we use topical emollients, and we use very low doses of retinoids that ranges from 10 to 20 milligrams per day from 6 to 12 months. This is another case where we have 2 sessions of Nd:YAG laser with FRAX3 parameters. Sometimes in cases with rosacea, we also use the FRAX3 parameters and with the systemic doxycycline, as this case. I can assure you very nice improvement with Nd:YAG with FRAX3 parameters in rosacea. And even if there is some sort of scarring, it is improved, because as you know, it's the FRAX3 parameters, we can use them for breaking the collagen, and the skin will produce new collagen with tightening. It is one of the what is called now the 4D rejuvenation of the skin using Nd:YAG and erbium laser together combined. This is the improvement that we have after the Nd:YAG FRAX3 parameters. What other thing that we use now is combined laser with peeling. So for acne lesions.
Going back, I don't want to stop you, but I noticed that there is improvement in the scar in the previous slide as well. So it's not only about controlling, there is telangiectasia improvement, the acne improved, and also the scars.
Yes, because you know, there is something called now the 4D parameters, which is 2 pulses of erbium and 2 pulses of Nd:YAG with different duration, pulse duration, very short pulse and very long pulse. FRAX3 is one of the steps of the 4D. So usually you get very nice tightening with the FRAX3 as a part of the 4D laser. Yes, it gave us very nice improvement even in the telangiectasia and the scarring as well. Now we are using something very strange, which is fractional CO2 with topical peeling. We called it fractional peeling. It is one thing that we used, and we made a very big study on it. We use a split face study. We did a split face study. We using a fractional CO2 at one side and using chemical peeling on the fractionated side and on the normal side without laser. You can see here the left side is treated with fractional CO2 with 10% salicylic acid, and the right side is treated only with 10% salicylic acid. This is the left side, which is treated with fractional CO2 with topical 10% salicylic acid, no medical treatment, no systemic, no topical treatment, just fractional CO2 and chemical peeling. And this is the right side with only 10% peeling. This is also before and after pictures. On the left side using fractional CO2 with 10% salicylic acid, and this is the right side with only 10% salicylic acid peeling. We also try to make more concentration, so we try to compare using fractional CO2 with 10% salicylic acid on the left side, and on the right side 20% salicylic acid. And we found that the left side, this is the left side, and this is which is fractional CO2 with 10%, compared to the right side, which is 20% salicylic acid. The fractional laser gave us very nice results and very nice improvement, as you see on the left side, compared to the right side, which carries twice the concentration of the peeling.
About the skin type, Dr. Hassan, in the previous slide, do you work safely with the parameter of fractional CO2 in this skin type because it's darker a bit? Is it safe to go for that?
It's not that safe, but you have to give very high restrictions for the patients to avoid sun exposure. So these patients came at night and they stay at home for 7 days at least. They only use some emollients like Meebo cream, Meebo ointment, that's it. And they don't go out to the sun at all for 1 or 2 weeks at least.
Perfect.
According to the skin type, which happens because of the fractional CO2 and the peeling, of course. It is highly irritative, but highly effective as well. We also try to blackheads, like using the microneedling, and instead of comedian extraction, we now use the bifurcators. So this is using microneedling and sometimes bifurcators, but we usually use the retinoids, topical retinoids, 2 weeks before any session. Now I will move to the stage where I tell my patient you have to get some prophylaxis from acne, because you have to take care of the environmental factors and their exposure. The skincare products that you use, it must be fitting to your skin, and photoprotection is essential. As we can see, there is a lot of agents that have effect on acne, and most of them are natural products, but patients, they need something like hygiene every day, because they are connecting the acne flares to some sort of dirt on the skin. So now we need like long-term skin health regimens to keep the intact skin and the healthy skin. And we also need some daily cleansing, moisturizing, and protection agents. So even with the American Academy and the European Academy do not recommend any cleansers in the treatment of acne and the protocols of treatment of acne. But I think in next few years, we need to choose some cleansers for patients, because they need cleansing the skin and taking care of skin daily to prevent the recurrence and the flares of acne. Even in 2006, they found that cleansing 2 times a day is beneficial than cleansing 1 or even 4 times a day. So another thing that I want to make sure that food is now very connected to the flares up of acne. So this is one of the instructions I give to my patients after treatment of acne to prevent flares and recurrence. High glycemic diets and increased milk consumption will lead to flares up of acne. So when you have Western diets, you have more acne and more flare-ups of acne. These are the 3 kinds of food that is connected to flares up of acne. So we have to tell our patients about them. The hyperglycemic carbohydrates, the milk and dairy products, and the saturated fats. like the French fries. They have a lot of mechanisms that is now proven to increase the acne flare-up and the acne recurrence. So you have to tell your patients after their treatments to stop this food to prevent the recurrence and the flares up of acne. So this is what I'm telling you, that it's not only the treatment with antibiotics, topical creams, instruments, it's also taking care of the daily activities of the patients, in cleaning their skin, keeping it healthy, and even the food intake to stay healthy and to prevent the flare-up and recurrence of acne. So our take-home message is the acne is a disease with multiple variants, which needs different approaches for treatment. Treatment is not only topical or systemic, it's lifestyling of the patients. Prophylaxis of lesions of acne is important target, and we have to take care of the food intake and daily skin care, which is extremely important. Thank you very much for your listening, and I hope I give you some ideas and some benefits of this talk. Thank you.
Thank you. Thank you, Dr. Hassan.
Thank you. Thank you so much, Dr. Hassan, for your presentation. Let's give the chance to Dr. Belkacem first to ask you, and then we can launch your question for the audience. Link to your lecture, and from the ones who will answer correctly, we will have a surprise from Bioderma. So let's first give the floor to Dr. Belkacem to ask her question.
Just going back to the last slides, talking about the food and its relation to the acne, do you think chocolate has a role in increasing the acne lesions, or you are against this?
I know you are a big fan of chocolate. I know this. So we have been colleagues for a year, so I know this. Actually, the last paper say that chocolate is not incriminated increasing acne. They say that milk and ice creams are incriminated increasing the acne, but milk products like yogurt, for instance, it's not incriminated. And chocolate, all the studies on chocolate, it's not saying that it has an influence on acne, but there is a gold standard. Whatever you eat, you get a flare-up. So this means that you have, you might have a problem, because every person is like a world by himself. So it may be increasing acne in some patients and not increasing acne in other patients.
Exactly. And also there is a lot of cases you did it by FRAC3. Do you recommend it compared to long pulsed Nd:YAG laser?
Yes, I do. Because of, first, there is no pain. And this is very important. The patient compliance for FRAC3 is very nice. Second, it's very effective. Usually the patient gets a very nice result within 1 week of the session. So I highly recommend the FRAC3. I even stopped like using the long pulsed Nd:YAG, the long pulse duration, like 5-6 years ago, after the invention of the FRAC3. Okay,
and no downtime almost.
No downtime. The patient do the session and gets out of the clinic to continue their life regularly.
Usually the patient of acne is very happy when they get the result and the face is completely cleared, and they all of a sudden disappear, and then again they are back when they get another flare-up. So do you recommend to have a regular follow-up with the patient after successful treatment plan?
Usually I tell them the prophylaxis protocol, and I tell them if there is a flare-up because of anything, like some stress or whatever, just come to see me as soon as possible to prevent going back to the step number 1. So usually when everything is in control, I don't see them. If the something went wrong, they usually come back to me.
Yeah, follow-up is very important, actually. Thank you, Dr. Hassan, very much for the interesting information and lecture. It was nice.
I see that we have some questions here. Do you prefer to
yes.
let them at the end, or what?
If you allow us, Dr. Hassan, we will go for the questions, because we have quite a good number of questions here and from a couple of the audience. And
okay.
I can tell you the first question from Dr. Sarwat Nasreen. Some patients believe that eating some fruits like mangoes cause flare-up of acne. Do you think there is a role of such fruits too?
if there is no solid scientific data, I cannot say. But as I told the Dr. Bilqis, every human being is a world by himself. So maybe somebody gets flares with acne with some food which is not recommended. Like for instance, in urticaria, we don't have many cases speaking about urticaria from coffee. But I have one friend that he had chronic urticaria for long times, and we didn't find anything except coffee. So you cannot say that this food is not doing any harm for acne, and because sometimes you get some patients that they have flare-ups with some food. But mango, I didn't see anybody complaining from flares of acne from mango.
There is a question about the milk consumption per day to cause acne here. How much milk consumption?
There is no data about this. There is no data about the milk consumption and how much will flare up the acne.
I think type of milk, I have read one article about the skim milk. I think it's in the processing of milk, there is a product, special product has an influence on the insulin factor, which affect the level of the acne or exacerbation of acne.
I think I've read some articles like this one also. Do you want to move in the questions? Because I have like 11 questions here.
Yes, exactly. The second question is from Dr. Saher Khalifa. What is the duration of the peeling? What was the duration?
Yes, I think he means how much time I leave the peeling after the fractional CO2. 10 minutes. 10 minutes and we wash the face.
Okay, clear. There is also another question from Dr. Batul. What is the duration between chemical peels and fractional laser? I think.
Yes, it's the same, 10 minutes.
It is the same 10 minutes. You already answered this.
But one coat, no double coats, just one simple.
One coat.
Yes,
okay.
Very fast coat, yes.
Dr. Saher again is asking, is peeling clinic or home use?
It's in clinic, no home use.
Yes. Another question, anonymously, your opinion of use of toners for skincare in general?
This is a very nice question. Actually, I'm not that guy that knows everything about the makeup for women. So I think Bilqis will answer this question for me. Yes? What about toners, Bilqis?
About a rule of cosmetic in acne?
Tuners. Using toners with acne.
Toners, most of the toners has rose water, which I do recommend because it improves the blood circulation. The idea of toning the skin just to have a regime in the morning to clean up the face and remove the remaining makeup if there is in the morning, or sometimes use it at night. But for my advice to the patient, I ask them to wash the face regularly, 2 to 3 times a day, use the sunblock in the morning. And rose water is nice if they can use it, but I don't recommend toner to be prescribed to acne patient actually.
Okay.
Thank you, Dr. Bilqis. So we have another question. Do you have some comparisons between your various treatment protocols? For example, single FRAX3 versus combination of FRAX3 plus some topicals versus just topicals to see the contribution of each of components?
Okay, I know the person who asked this question. He's a very important person, and I would like to welcome him. He's Dr. Zinko from Fotona, the inventor of the FRAX3 parameters for NDAC. No, I didn't make these comparisons, but actually, if you saw the first patient, it was only FRAX3 with no topical treatment. And this was one example of more than 100 patients. So it is working. The FRAX3 without any topical or systemic treatment is working in acne, even in mild cases. I have another question, which is very nice. Any history of paradoxical stimulation of unwanted hair growth with the use of NDAC for management of acne? I think we all have this paradoxical hair stimulation when we have hair removal of the face. But actually, this usually happens in the mustache area. Am I right, Bilqis? We usually have this.
Yeah, and sometimes here, and the fine hair here.
Okay, so I didn't get any case of this. And maybe patients of acne are like lucky because they don't have acne in this area. So they usually have acne in these areas, which doesn't have this paradoxical stimulation of unwanted hair after the NDAG hair removal.
Okay, so Dr. Hassan, we also have another question, which is it safe to do fractional laser while taking isotretinoin? Also, how to deal with post-inflammatory erythema after cure?
Okay, so many papers said that do not do any maneuvers for the face while taking isotretinoin, and then some papers emerged and said that there is no keloidal tendency. I prefer the second one. But usually, I usually start treating while two things. First, I'm tapering the dose down of the isotretinoin. Second, there is no active lesions. So I usually do this after in these two cases. So I do fractional laser safely with isotretinoin when there is no active lesions and while I'm tapering the dose of the isotretinoin. There is nothing about this. About the erythema, while doing the fractional peeling, I'll tell you the truth. We do not do the fractional peeling until we give the patient one shot of dexamethasone because it is severe inflammation and they cannot bear this inflammation. So we start before doing the session, we give one shot of intramuscular dexamethasone. They do the shot and we just use Mibo for 1 week, 5 times a day. And they usually wash their face with just water, no soups, no cleansers, nothing for 1 week.
But at least you need 1 week to stop the isotretinoin before doing the fractional CO2, Dr. Hassan?
No, I do it while tapering the dose, while they are still on isotretinoin, because there is a lot of papers say that there is no keloidal tendency while doing maneuvers like fractional lasers with isotretinoin treatment.
Okay.
Okay, clear.
For me, in case I'm doing NDAG laser for whatever indication, I prefer to just taper it, as Dr. Hassan said, also around 1 week, at least 2 days before the procedure, no topical or systemic taken.
Our last question will be, do you recommend the fractional laser chemical peel in acne patients with coexisting unstable vitiligo?
No, sir. No, I don't recommend to do any maneuvers to a skin of unstable vitiligo patient, even the hair removal, because you know the Kepner phenomena, we might get spreading of vitiligo. So I don't recommend to do so.
So I think we already finished with our questions for Dr. Hassan Al-Fakihani. Thank you so much for your interesting presentation. And we will come again after Dr. Balkis' presentation to gather also the questions. Thank you so much. Dr. Balkis, please.
Thank you. I'm going to...
Just Dr. Okay.
Stop sharing, yes.
Okay,
yeah.
Thank you.
I need to open my presentation. Mm-hmm. Yes. Can you see it now?
Not yet. Just share your screen and.
Not yet.
Is it on now?
Now we can see your screen and just choose your presentation.
Okay.
Yeah.
My name is Belkis Marwan. Today I'm talking about the advanced technique in treatment of acne scars. As a continuation of the lecture of Dr. Hassan, he spoke about active acne, how to treat it, and acne scars as well as redness and hyperpigmentation. Usually the acne is treatable, but when you reach to the acne scar level, it's permanent condition. So we have to be more realistic with the patient and give them the, don't overpromise and don't give them more promises or over expectation in order to meet their demand. So how the acne scars form when we have deep lesions like cysts and nodules. pustules, and also when the patient is delaying the treatment of acne or picking the pimples, or if there is history of acne scars. When we have severe inflammatory acne lesions like nodular or cystic acne, it affects deeply the underlying tissue and cause damage to the normal component of the skin and replace it by abnormal collagen. So we have two scenarios will happen. In severe acne, either it will heal, the wound healing or the acne healing will happen with too much collagen production, or it will heal with less collagen. When we have, so this is the types of scar. When we have less collagen, it will end up by atrophic scar. When you have more collagen, will end up by hypertrophic scar. In mild to moderate acne, healing usually ends up by redness and hyperpigmentation. In hypertrophic scar, this is the less common. We see it in our clinic. It's usually erythematous, raised, pruritic in the beginning, and turn to keloidal later. And how to treat it? Usually I prefer to turn the keloidal or hypertrophic scars to atrophic. So we inject steroid or hyaluronidase or both together. I prefer to inject the both. So we make the lesion atrophic and flat, and then we manage as an atrophic scar after by microneedling, by laser therapy, either ablative or non-ablative. While in acne redness, it's following the mild acne, moderate acne, and it can be treated topically along with the procedures done in the clinic. And it's usually minor procedure. We can interfere with the laser, microneedling, chemical peeling, light emitting diode, radiofrequency. But going to the main topic of the acne scars today, I'll talk more about the atrophic scars, which is due to replacement of normal component of the derms by abnormal collagen or lack of collagen. So we have three types of scars. The most annoying and the most complicated scar and annoying the patient is the ice pick scar, because it's narrow and deep. And if it's multiple with white pores, it's cosmetically, it's annoying the patient. So this is the ice pick scar as we see here in the figure. The rolling scar, it has broad depression with the sloping edge, while in box scar, it's broad depression like a box, but has a sharp demarcated edge. And there is a variety of treatment of atrophic scars. The priority for me for treatment of any atrophic scars is to go for microdermabrasion and subcision. And according to the skin type, according to the age, to the thickness of the skin, according to the condition and depth of the scar, we choose the proper treatment. A combination therapy, I prefer it in treatment of any scar. So start by microdermabrasion, subcision, going through the plasma-based energy device, microneedling, either dermapen or MRF, chemical peeling, lasers, fillers. When I do subcision, I prefer when I withdraw the needle, I inject hyaluronic acid. If it's deep scars, I inject fillers, but not in the same session. And if it is moderate to severe scar, we inject hyaluronic acid or a skin booster, mesotherapy or a skin booster. And I prefer when we have, sometimes we have active lesion and we have scars. So I prefer to put the patient on light emitting diode. As Dr. Hassan mentioned, it's one of the most important treatment in order to calm down the skin and reduce the inflammation. Then we can proceed with the scars. But when we have the scar completely, we have to choose, number one, to do microdermabrasion, then do the subcision by introducing the needle. There are many types of needles. We can use the knocker needle, the regular needle even, but the gauge of between 26 to 29. And the idea of subcision, there is many ways how to insert the needle, either by linear insertion or the fanning horizontal movement, which is the one I use it, or vertical movement in order to traumatize the skin. So the idea of using the subcision is to cut the fibrous tissue under the scar to make the mobility or the scar more elevated. And while we withdraw the needle, I inject material, but sometimes I don't need if it's mild scar. And then the idea also with the multiple trauma of the needling, it enhances the wound healing process. So this promote the collagen elastin and elevate the depressed scar. And then another procedure I prefer to go for is the plasma-based energy device. It's a very simple device. It has an stainless steel electrode at the end of the plastic handpiece. And the idea of the plasma that when we use this device, there is electric energy released from the pen, which responsible for the ionization happening, as you see the arc here in the figure, between the tip and the skin, and this will lead to ionization of oxygen and nitrogen in the air, and the release the spark, as you see this plasma. This plasma, when it's released, there is two things happening. There is sublimation is happening at the level of the epidermis, lead to instant contraction and tightening when you talk about the scar. So how I treat the scar by the plasma, I have the pressed scar, so I go by this plasma device at the border in order to flatten the border and make it at the same level of the scar. We might need 1 session or 2 sessions, and here this plasma is non-selective photothermolysis, so it causes severe inflammatory reaction. So preparation of the skin is very important before and after the procedure. So I would prefer to go also for light emitting diode masks after this session, especially for the darker skin type. The first thing is happening from the plasma release is to cause instant tightening or contraction to the epidermis due to the sublimation, vaporization of the solid of the skin cells and convert it to gas. And then there is some of these plasma will migrate to the dermis to stimulate the fibroblast to produce more collagen and elastin. Also the wound healing process, because it will form a minute crust. And this is the wound healing process will help in release of growth factors, which will help in migration of fibroblasts to the site of energy and produce more collagen and elastin. So I will now show the cases before and after. As we see here, I start by the subcision. After microdermabrasion, I did subcision, and I do the plasma energy at the periphery of the scar. So I make it, as you see here, after. It's flatter. I sometimes I don't inject at the same day, because if we have multiple scars, so bleeding is happening or hematoma, so we will not be able to inject and do plasma at the same day. This is before and after 1 session of the subcision and plasma energy device. We can see it's more flat, and even the white pores is improved. We worked on that by the plasma pen as well. This is another case. I did 2 sessions of subcision and 2 sessions of plasma energy and 2 sessions of dermapen. You can see improvement of the acne redness and the scars as well. The same case. Another case also for the most of the acne scars here is ice pick scar. I prefer to start with the plasma energy followed by dermapen after a month.
So you usually start treating the scars with subcisions?
Yes, I prefer to start with the subcision, Dr. Hassan, because any procedure we use to treat the scar will improve the epidermis and dermis. So we have the pressed scar, and the skin around the scar will be stimulated by whatever procedure we'll do. So we'll get more thickened skin around the scar. So if you don't do subcision and elevate this depression and remove the attachment to the underlying tissue, so the thickness of surrounding the surrounding skin around the scar will increase, and the scar will look more obvious. And then another procedure I use it is fractional microneedling, either dermapen or MRF. Dermapen, as you see the device, and it's very I think famous device now. It has a disposable tip with 12 or more than this number micro needles. It creates micro channels. These micro channels work as a confluent zone of superficial bleeding at the site of where we work, and this work as a stimulus to release growth factors. When the growth factors released, stimulate new collagen production and new vascularization, because it helps for the migration of the fibroblast to the site of injury to produce more collagen and elastin. Usually the result we achieve it is not upon doing the procedure or after 1 month or 3 months. We know that after the healing, it takes between 28 days with the time of formation of collagen, immature collagen to become mature up to 6 months, but we have to expect that we'll get a long-term improvement as long as we stay and do a good follow-up and good skin care by microdermabrasion and treatment as well. Then we talk about dermapen. Then another procedure I use it in the treatment of the acne scars is the MRF, microneedling radiofrequency. It's a non-ionizing electromagnetic radiation. We use it, it's the same idea of microneedling and coming with the radiofrequency. So when we insert the tip of the device or the machine, it will deliver a heat. This heat, the deep dermis to 40 2 degree and responsible for formation of small spear-like shape coagulation zone in the derms. We need to do multiple passes with different depth to cover the whole area of the derms. And the idea of using insulated needles is to make sure that the epidermis is not affected or there is no thermal injury while using the while we get the needle outside the skin. We have the idea of microneedling technique is to either dermapen or MRF is to improve the blood circulation and also stimulate the mild inflammatory action by stimulating the fibroblast migration. And also when we do traumatizing or trauma to the skin by microneedling or multiple needles, this will break the fibrous tissue, and this also will help to get rid of the some fibrosis we have. This is a case before and after subcision and dermapen. In the beginning, this is one of the old cases, but if it's me today, I'll manage this case. I will start to do plasma pen or plasma energy device in order to flatten the border, and this will save time and save money for the patient, because budget-wise, you might lose the patient if you spend long time doing another procedures. So I have these tools here. If you have fractional erbium to do focused beam, this is what I have, but not in Dubai. This will be the faster scenario to start with the plasma pen or plasma energy, the idea to flatten the border, and then at the end we do the derma pen. But before, this is one of the old cases. I did 5 sessions. As you see, the ice pick scars is more, and also the idea of microneedling, it works all over the face, so it improves the white pores as well.
So this is the most stubborn scars that you face, or which kind?
Exactly, Dr. Hassan. Because if I start to do these procedures today, my treatment of choice will be the subcision and plasma energy machine in order to flatten the lesion. And we do subcision, of course, but we spend many sessions of the derma pen in order to achieve these results. And this is another case. We did subcision, dermapen, PRP, and I did for her MRF. And we see here the result is improving gradually over 3 years. So this patient, when she came for follow-up after 3 years, I saw marked improvement, actually, because this is not what the figure I saw it after 1 year of treatment. So as long as you stay, you will get better effect. The same patient after 3 years. Well, the most see how many sessions I did. 6 dermapen, and I did MRF, and I did PRP every time with dermapen. So it's a long-term treatment plan. This is another case. 3 sessions done here by subcision and 3 dermapen, and I introduced also the MRF with PRP. I used to inject here filler. It's not written here in the slide, but this case I inject for her skin booster, actually. This is the same case as well. The most stubborn scars here, as you see in the forehead, but subcision helped here a lot. Some doctors, they do infiltration anesthesia, so they inject anesthesia in order, if we have large area of the scars, in order to be less painful while we are treating the scar. This is another case doing dermapen as well. We can see at this area, and here the scars are less. The dermapen helping to improve the pores, the scars, and pigmentation. This is done by dermapen. Here, the non-invasive radiofrequency being done for the post-acne redness by radiofrequency only. And then when we go for NDIAG laser, I used actually the long pulse NDIAG laser with a parameter of 12 joules, the same parameter used Dr. Hassan, but a longer pulse duration to stimulate, of course, the it reduces the size of the gland by the heat effect, and also improve the collagen production. As you see here, she did first 2 sessions of laser, then followed by dermapen. We didn't focus on the scars. What's most annoying for her is the colors and the acne. And I put this patient on systemic antibiotic for 3 weeks in order to avoid the recurrence of acne during the treatment plan.
pulse Nd:YAG, not FRAX3.
No, a long pulse Nd:YAG. I will try the FRAX3 when I go Egypt, inshallah. And then this is another case I did for him, the same, but 3 sessions of Nd:YAG. Another case, we can see improvement of the whole skin texture, the white pores, the scars as well by doing laser, but I have to introduce microneedling because laser is not enough. So we need up to 10 or 15 sessions because it's a long-term treatment or long-lasting effect. We cannot see instant effect like the invasive treatment. Here also before and after. And then I use the carbon laser peel. When we apply the carbon, it's taken by stratum corneum, then take part of this carbon to the sebaceous gland and hair follicle. So they claim that carbon laser peel can work for active acne for this reason, and also due to the exfoliation of superficial layers. When the laser taken, when the carbon take the laser light and convert it to heat, it exfoliates the epidermis and remove the dead skin cells, and we can see the effect. I can see the effect from laser carbon peel due to the minor exfoliation or the peeling happening, but the full efficacy of the laser will be lessened because of the carbon. I mean the depth of penetration. Then when you do fractional erbium laser, either by focused beam at the periphery of the lesion or doing the full face rejuvenation, as in this case, she is my niece actually. I did 1 case in Egypt, and I don't have much experience yet in this. In that, one of the 4D, also one of the 4D steps after microdermabrasion. And then I used also chemical peeling and treatment of the acne scars according to the type of scar. Talking more about the superficial scars or the post-acne acne redness or hyperpigmentation. When we talk about the most I use is glycolic acid, salicylic acid, 20 to 30%, and this is for mild post-acne redness and hyperpigmentation. Use TCA up to 35 for mild to moderate acne or superficial scars. But when we go for higher level or concentration of TCA, we do the TCA cross for deep scars. As you see here, we did peeling 4 sessions and followed by 2 dermapen sessions. And here only salicylic acid and TCA peel. And TCA peel here. So I do prefer, as you see, the combination therapy according to the case. So we get benefit out of the each procedure separately. And the end result, we can achieve it after a long duration, could be from 6 months up to 2 years. And the treatment of choice here for any scar from beginning is to do subcision, and then according to the type of the scar. And sometimes the scars or the patient's coming with the treatment already or treated scars, so we can go directly for microneedling. According to the situation, we have to judge, and some protection with the topical application is very important during the course of treatment. Thank you very much.
Thank you.
Thank you so much, Dr. Balkis. Yeah. Dr. Hassan, do you want to lead the questions to Dr. Balkis before we go into the question and answers as well?
Very nice results. I know that you are using multiple maneuvers for the same patient, and I prefer doing this too. I always say combined treatment is gives better results, far better results than single protocol of treatment. This is very nice, and this is very nice combining treatments and protocols together. Excellent result.
Thank you, Dr. Hassan. And also, we have to put in our mind the budget of the patient. I have colleagues in Egypt, Dr. Dua and Dr. Nurhan. Dr. Nurhan, she is, mashallah, doing a nice, getting a nice results in scar treatment by very less. I mean, there is no much tools like subcisions and whatever procedures she have or machines she has in the university. Mashallah, I mean, when we talk about the acne scars, we don't have to go for lasers and for the most expensive procedures. We have to read the budget of the patient, and we can manage by simple tools to get the best result.
Thank you, Dr. Hassan. Vanetta, please go to the questions.
I'd like to thank once again Dr. Balkis and Dr. Hassan. for the wonderful and very informative and practical presentations and sharing of their rich experience and different like instrumentarium of tools. So we have some questions already in the Q&A session. So let's start one by one. Carbox scar, plasma technology, is it a good option?
Carboxy, sorry. Can I read the questions?
Yes, the first question for carbox scars, is plasma technology a good option?
Carbox technology, I cannot get.
No, plasma technology in
plasma technology
scars.
for carbox scar.
Acne scars, in the box scars. It's a good technology.
Yes. Yeah, of course. In all types of scars, it's a very good technology. What I do now, if the skin type is helping me, skin type between most we see here between 3 to 4, up to 5. But I prepare the skin in skin type 4 or 5. I prepare them 1 week before the procedure, and then I do the procedure according to the skin type and skin thickness. I have to adjust the parameter of the plasma to determine the level of plasma energy derived. And then the post-care skincare is very important after the procedure, even in skin type 5, is putting the patient for 6 sessions of light emitting diode, the mixed light, which will help to reduce the inflammatory reaction happening because of the plasma. So the healing process will go faster, and along with topical application at home, strong topical application, I put a good regime for treatment after that, so we ensure that the result is good without any side effects. Alhamdulillah.
Thank you for the answer. The next question is about ice pick scars. I think you already answered, but once again to summarize, what is your best protocol to treat ice pick scars?
The ice pick scar, sometimes according to the number of scars in the skin, if you have around 4 or 5, I can do the same session, subcision, because it's very narrow and deep, so we cannot ensure that there is no bleeding will happen, especially if it's confluent zone. So we do subcision, make sure there is no bleeding or hematoma, so we can proceed by injecting and doing also the plasma energy at the same session. But if it's large area all over the cheek, so I do subcision 1 day, and then another day after 1 week, when the hematoma is resolved, then we can interfere with the plasma energy.
Okay, thank you. Next question. What is your treatment of choice for erythematous macular atrophic scars, and second for papular hypertrophic scars?
Papular hypertrophic scars, in the first one, we do a dermapen. So any atrophic lesion, I do prefer to do a microneedling dermapen, is giving a very good result. For the second question, hypertrophic scar, right?
Yes, papular hypertrophic scar.
Sorry?
Papular hypertrophic scar.
For hypertrophic scar, as I said in the beginning, we inject steroid or hyaluronidase, or the both. Sometimes I put only hyaluronidase if it is in a place, not covered place. So I prefer to go very slowly by hyaluronidase to make it flat. Then I treat it when it becomes atrophic scar as the same treatment plan for atrophic scars.
Okay. Next question. What size of dermapen do you use for the treatment?
I think they mean the depth, how deep do you go inside?
Depth of penetration, I use between 1.2 to 1.5. Sometimes I go very aggressively up to 2 if the skin type is helping me. Especially skin type 3, I go very freely, but be careful, because microneedling is tricky a bit, because sometimes in skin type 5 and you go very vigorously, and the wound healing process is not helping you in the darker skin type.
Okay. What is your opinion on derma roller in management of acne scars?
I don't like the derma roller actually, because the derma roller, it has the direction of the needles is coming not in parallel like the dermapen. The dermapen, the nice thing in dermapen that it's vertical and it works by vibration high speed, and it doesn't traumatize the epidermis. If we work by derma roller at 0.5 millimeter, home use, that's fine to do it as a home regime, and I don't mind. But Dermapen is superior in the results in treatment of acne scars rather than compared to the derma roller.
Actually, I don't agree with while using derma roller at home for two reasons. First, the patient or the lady will not put the efficient and sufficient pressure on the derma roller on her face because of the pain. Second, it is very small depth, 0.25 millimeters. So I don't think it is effective. It's just like rubbing the skin with a very harsh cloth or something like this.
It's look what will happen with 0.5 is a slight exfoliation to the skin, so it's placebo. So when
Yes.
slight exfoliation is happening, so she will be happy that there is epidermal regeneration or some peeling will happen. But
Yes.
in fact, anything is done more professional in clinic will be more beneficial.
Yeah.
Okay, we have a couple of questions about CO2 lasers. Maybe both of you can share your opinion on that one.
What about CO2 laser? CO2 laser is a very nice laser, and it's not that expensive like the erbium, but it is very tricky because you have to be very cautious with the dark skin. And is it the most effective? For me, yes. I used it for several years. It is very effective, but you have to be very cautious while using it.
I use the CO2 laser, yes, for long duration in Armenia in my university, but here in Dubai, no, because you know the downtime and most of the women are working, so we can go for fractional erbium. It's more safer. Even I'm saying the plasma, it takes long time for me. I have to, in order to compromise, the patient wants to treat the acne scar, so they have to know that this should stay at home for 2 weeks. So the considering the patient condition is very important.
Okay, next question. In your experience, have the results of treatment of scars, do the results of treatment of scars vary between gender? I mean, are they different according to the gender and age of the patients?
The wound healing process in younger age is faster. The skin in male is thicker, but the results are the same. The same result is happening, but usually the male when they have acne scars, sometimes I didn't see a lot of cases, but it's more deep because they have thicker skin and they have thicker pilosebaceous units and they have more complication. So some skin, yeah, it's according to the skin thickness and a skin type, but it's for me the result is the same for both.
Okay. Next question, can we use carboxy laser in subcision instead of needles?
I don't know what carboxy laser. I've never heard about this.
Carboxy therapy, maybe. Carbon laser peel, maybe, or
carbon, yes. Maybe they mean the carbon.
Carboxy laser, yes.
Okay.
I don't know. If it's carbon laser peel, yes, we can use it for post-acne redness and hyperpigmentation, but I don't see a result in the scars because the laser doesn't go very deep to promote the collagen or work on the deeper thermal components.
Next question, don't you think excision is the best for ice pick scars?
Some of my colleagues, they do punch elevation, but punch excision can go for another scar. So when we do the punch excision and then we stitch it or leave it for normal wound healing process, we have tendency for more scar. I didn't experience it. If Dr. Hassan has an experience in that, I didn't try it actually, but I have experience from my colleague in Egypt. She's doing punch elevation and I saw a very nice result. She put the punch biopsy and elevate it and keep it at the same level of the surrounding skin, put a dressing and wait for the normal healing process to happen. And then she can do after that fractional erbium to flatten if there is any elevation happening from the healing process. But for me, I didn't do it. Plastic surgeon, they prefer this idea actually. But I don't want to go for the risk of forming another scar. So for me, I'll go for another scenario, what I mentioned in the lecture.
Okay, a couple of more questions. What would be the management of acne and rosacea? Acne and rosacea.
I think rosacea is very nice with treating with doxycycline 40 milligrams daily plus Nd:YAG laser with Frax-D parameters. would be very nice.
And I have also a very good experience with the Dermapen. The patient is very, very happy with the Dermapen doing, what's the role of Dermapen in acne rosacea due to the epidermal regeneration. I don't know exactly, but it helps to reduce the inflammation. It doesn't work, of course, for the telangiectasia, but it improves the redness and the pimples. I found a very good result, and also the flushing effect is reducing with time since the redness is reduced as well.
Okay, according to your experience, is the fractional laser more effective or radiofrequency microneedling in treating acne scars?
Well, I don't have much experience with fractional laser, but I have more with the microneedling, with Nd:YAG laser, with the tools I used in the lecture, like plasma energy. But I do believe that fractional erbium, the focus beam, to work by the same idea of plasma energy at the periphery or the border of the scar to flatten it and go for the same. It's the same idea, but using different machines. So I think it's very useful. It's according to what you have, what tools you have. This is what I have here in Dubai, so I use it, and it's useful.
Okay, we have a couple of questions also in the chat box to both of you. Maybe, is there a relation between colonic diseases and acne, and is there a relation between food intolerances and acne?
Actually, these are very good questions. But I don't. I have to go through the articles to know the answers. I don't have a specific answer for these two questions. But I promise I will go through, and maybe next time I have the answers for this.
So we have to answer Dr. Dua, huh? Dr. Dua Sharif.
Yes.
The scientific question is Dr. Dua. Yes.
Okay. Okay. I think we covered the questions so far. So
not yet. There is one more question. What is the reason for recurrence?
For the food intolerance and acne, I would like to add, as Dr. Hassan mentioned, I think it has a role. When the patient has an intolerance to food, it exacerbates the acne. This is what I have noticed. I just was discussing with him yesterday that I have one patient, she had severe acne, and then we was admitted to the hospital and stopped all the junk food. The acne reduced completely. And then when she did food intolerance, we discovered that there's a lot of sweets she's sensitive to. So of course the food has a role with acne, and food intolerance I think has because she's more allergic to the food than the normal individual, to the foods exacerbating the acne.
And,
thank you so much, Dr. Balkis.
I will just ask one follow-up question. Then in this case, should the patient make like a food intolerance test to identify from what is the allergy, and then to minimize the risk of having the acne, like a prevention protocol?
Exactly. Yeah.
Okay. Okay.
Yeah, I prefer, yes. For acne, it came with coincidence actually with this patient, because she was admitted, and when she did food intolerance, we correlate, and when she stopped these intolerant foods, her acne condition improved. So this could be, if they can afford it, why not?
Okay.
Perfect. So we have a question. What are the reasons of recurrence after completed systemic retinoids course?
Actually, because not following the prophylactic step that we talked about. The treatment of acne is not finished after stopping the treatment, because acne keeps getting on and off till the age of 40 and sometimes 45 in women. So with every menstrual cycle, hair removal of the face, stress, she might get some acne. So she just have to follow up with prophylactic treatment like cleansers, using the suitable skincare products, watching for environmental factors, taking the right food and eating the right food. If she didn't do this, she will have a lot of recurrences and flares up of acne.
And hormonal factor as well. We sometimes we have complete resolution to the acne, and it's completely stopped the appearance of acne lesions, and all of a sudden, due to stress or the flaring up of her PCO condition, if she has, or any hormonal imbalance, progesterone, whatever the reason, increasing the progesterone level, it affects the acne, of course. So considering the other factors of acne, it's endogenous factors. So whatever we do will improve the existing acne, but there is nothing to guarantee it won't come back.
Clear. We have the last question from Dr. Amal. Can we get a recorded video for that? You will find the recorded video on the eye dermatology Facebook group, Dr. Amal, and we can send you all the contacts after the meeting. Actually, there is a lot of thanks for both of you, Dr. Balkis and Dr. Hassan, about the nice presentations. Thank you so much. And I think we already finished with the questions on the chat as well.
Thank you very much.
So now, last but not least, we can launch the two questions. One question per each of the lectures of Dr. Hassan and Dr. Belkais. Related to their presentation, and after that you will share, of course, the right answer, and of course we will have a surprise for the first attendees with the correct answer per each that we'll follow up with. So I will launch the first question, which is related to Dr. Hassan lecture. And the question is, what kind of laser is beneficial in the treatment of active acne? So please, attendees, now you can vote for the right question, the right answer to this question. Long pulse NDAC, NDAC with very short pulse duration, fractional CO2 with topical additives, all of the above, or Alexandrite laser. Let's allow some time for the voting.
So they were focusing in the lecture, huh?
Yes.
Okay, let's give a little bit more time. Ten more seconds. Okay, so we can end the polling now. And Dr. Hassan, please share the right answer.
It is all of the above. Yes,
okay.
They are all beneficial with different success rates, but all of them are beneficial. The long pulse, the short pulse duration, NDN, and the fractional CO2 is topical additives. So the right answer is all of the above.
Okay, we have 7 attendees with the right answer. We will check who was the first one, and he will receive like a small surprise from Bioderma. And now I'd like to launch the second question, which is related to Dr. Belkais' lecture. And the question is, what is the treatment of choice for ice peak acne scar according to the lecture and my shared practice in it? First answer, subcision. Second, plasma-based energy device. Third, microneedling technique. Fourth, ablative lasers. And last option, answers 1 and 2, subcision and plasma-based device.
It seems I was very clear. It seems I said the answer.
Okay, some more time, half a minute more. Okay. 5 more seconds. Last votes. We have a clear favorite answer here. Let's see if that is the correct one. Okay, end of the poll. And what is the correct answer?
Yes, it is the subseasonal plasma-based energy, which is the 72%.
Okay, so we have 26 attendees with the correct answer, and we will check out who was the first one to give this correct answer, and we will approach this attendee. I'd like to thank you so much once again for the excellent presentation, very informative content, this very interesting discussion and exchange between you and with all the attendees, and this really added value to eye dermatology by now. We hope to see you again in this format, in other formats. And in case we have some more follow-up questions to you, if you don't mind, we will share with them. And of course, please stay tuned to the next events and content in our eye dermatology Facebook group. To all the attendees who are not still members, you can find the group on Facebook and just send the request to become a member, because it's a closed group, and we will of course allow you to become a member.
Yeah.
And we have a lot of activities there, and we plan to have further more activities. And from NAUS and from Marwa, all the team, I'd like to thank you so much once again, and to wish you a lovely evening and lovely weekend ahead.
Thank you.
Thank you, Dr. Balkis. Thank you, Dr. Hassan. Thanks for all our honored attendees and our honored doctor. Thank you.
It was
Appreciate.
nice.
Thank you. Good night. Good night, everyone.
Good night. Thank you once again.
Thank you. Nice evening.